A Tale of Two Hygienists presents this week's TIPisode, quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode.
Well, hello everyone. This is Tom Viola from tomviola.com and Pharmacology Declassified, coming at you with yet another TIPisode. I'm lucky and fortunate to be with you here. And the theme of this TIPisode is one word: polypharmacy. Now, that word polypharmacy sounds like there's too many pharmacies on one street in the city. No, polypharmacy refers to what happens when you use multiple medications to treat multiple medical conditions. And those medications have effects that are either intended or non-intended, but unfortunately amplify or magnify the effects of the other medications. And so it's an interesting syndrome, subtle but complicated at the same time. You know, lots of drugs lead to lots of effects, and sometimes they're not always the effects we intended. I tell my students in my pharmacology classes all the time that we design drugs to be selective, to be specific in what they do. And we fail miserably almost every time. Why? Because medications don't just have that one selected activity. They also cause other effects in the body. And, you know, we call them side effects, but they're effects nonetheless. So the thing is, you may think that polypharmacy is something that's just a problem for older people. And it kind of makes sense because older people experience more health challenges as they age, and therefore polypharmacy should be more common amongst them. But that's not necessarily the case anymore. We're getting much better at diagnosing illnesses, and we're getting much better at prescribing medications to treat those illnesses. So polypharmacy isn't just a syndrome that affects people of advanced age. It can affect people of any age. Why does this happen anyway? Well, we all know what. Taking more medications always increases the risk of drug-to-drug interactions. That's obvious. But remember, it's not just pharmacology, it's also pharmacodynamics. Individual physiology is maddeningly complex. And yes, you could make the argument again. Well, an older person, has undergone physiologic changes that increase the likelihood of adverse drug reactions. As you get older, you lose muscle, you gain fat, and that changes the compartmentalization of drugs in your body. And then, your liver and kidneys don't process drugs the way they used to. Maybe it's more slowly, so that increases the risk of adverse effects. All true, but remember that younger folks who take medications may end up having the same syndrome because those medications alter the effect of the liver and kidney as well. So it's not just age, it could very well be medications and adverse drug reactions making polypharmacy just about a problem for any age. Well, one thing we know for sure, it's not just prescription drugs. Many people are taking over-the-counter drugs, non-prescription drugs, and dietary supplements. And those, while they're not drugs in their own right per se, can have effects that can increase this risk of polypharmacy as well. Such is the case with these newer anticoagulants. We call them novel oral anticoagulants, NOACs, because they don't interfere with vitamin K the way our old standby Coumadin does. But the issue here is that these drugs, while they're probably superior to Coumadin in lots of ways and make docs very happy because they don't require the frequent blood draws and the monitoring that Coumadin does, they still carry significant risks for bleeding. And those patients who get these medications, you would know them as medications like Xarelto and Eliquis. Well, they still need to understand that these medications interact not necessarily very well with over-the-counter drugs and even dietary supplements that are available and probably in the patient's medicine cabinet waiting to be taken. So as a matter of fact, there was a study done on this in the Journal of the American Geriatric Society back in 2019. where 791 patients in California who had been prescribed Eliquis were asked a series of questions to assess their knowledge of potential interactions, as well as what types of over-the-counter drugs and dietary supplements they were taking. And while the labeling instructions and warnings for drugs like Xarelto and Eliquis are clear and easy to understand, this study revealed worrisome gaps in practice between what the known risks are and what the individual patient's behaviors were. So, for example, 97% of the patients surveyed, and we're talking about 771 out of 791, reported using over-the-counter products in addition to this anticoagulant. 66% were either unaware or incorrect about the increased potential for serious bleedings with something as innocuous as an NSAID. And 33% of the patients said they took at least one over-the-counter product that had a potentially serious interaction with Eliquis. Even 14% of the patients, I know this sounds hard to believe, reported taking aspirin daily, even when they were told not to or never told to take aspirin. And the best part, I believe, is that 166 of those patients, about 20%, said what? They took nutritional supplements that ended up increasing the risk of bleeding and increasing the overall risk to the patient. Now, the irony here is these patients are taking nutritional supplements to support their overall health, and the use of those supplements, along with this drug, Eliquis, is actually increasing their risk of serious adverse effects and potentially death. So, to sum up, my friends, make sure when you take a medical history, as I've talked to you about in the past, it's those three questions again. What do you take? Why do you take it? And did you take it today? And make sure you've got a pretty good understanding of the dietary supplements, especially, that increase the risk of bleeding. Of course, you know the ones that all start with a G, right? Garlic, ginger, ginkgo, ginseng, and yes, even glucosamine, Dong Quai, which is pretty popular for treating menopausal symptoms, CoQ10, even melatonin can increase the risk of bleeding. So be prepared, be knowledgeable. And if you don't know whether or not a nutritional supplement, dietary supplement, causes bleeding, go look it up. There's some pretty good resources out there, and you just might make a difference in that patient's life. And without you preventing polypharmacy, who knows what might befall that patient. So once again, it's my privilege to be with you on these TIPisodes. I enjoy being with you on a regular basis, looking forward to more of the same. If you'd like to reach out to me with any questions, feel free to. You can find me at tomviola.com. And of course, I'm looking forward to hearing from you and seeing you at some of my live seminars.
We hope you enjoyed this week's TIPisode. Be sure to reach out to our guest experts and let them know how helpful their tips were. Follow A Tale of Two Hygienists on Facebook, Instagram, and head over to ataleoftwohygienist.com and subscribe to our newsletter. You can also email us at ataleoftwohygienist@gmail.com and keep listening for more awesome content from your unofficial dental hygiene podcast.